This is a video of Arthroscopic ACL Reconstruction. It begins with the diagnostic round beginning from the suprapatellar pouch, lateral gutter, medial gutter, and looking at the undersurface of the patella and seeing the patellar tracking. Then we come into the intercondylar notch and see for the ligamentum mucosum, the medial meniscus integrity, and goes into the lateral joint space to see for the lateral meniscus. Here we can see a small tear in the posterior horn of the lateral meniscus. The lateral We look for the popliteus between the lateral femoral condyle and the upper surface of the lateral meniscus. Then we again go back to the medial joint space and poke in a needle into the joint for anteromedial working portal, which is a far anteromedial portal. Then under vision, with the help of a knife, stab knife, we make an incision and dilate it with a hemostat. Then we insert a shaver to shave off the Hoffa's fat pad and the ACL remnant. This is lambda sign ACL attaching to the PCL. Then we try to reach over the top position, which is behind the lateral femoral condyle. This is end-on view from a high anteromedial portal, seeing the ACL footprint. Then we insert the femoral offset and a bead pin over it and drill through and through. In the lateral femoral condyle. After this, we take out the offset and drill with a 4 mm cannulated reamer and drill to the far lateral cortex of the lateral femoral condyle. Then we take out this drill bit as well as the bead pin and measure the tunnel size with the help of depth gauge. The tunnel size here comes around 35 mm. Then we again reinsert the bead pin through the same soft tissue window and do drilling with the help of graft diameter flower tip reamer, which is just short 10 mm short of the far cortex. That is around 25 for the endobutton to flip. Then over this, we take the reamer out and over this bead pin, we put in a shuttle suture and secure it outside the joint with the help of a hemostat. Then we drill the tibial tunnel by keeping the drill guide at around 55 degree at the center of the ACL footprint in line with the posterior border of the anterior horn of the lateral meniscus. First, the bead pin is passed and over it the graft diameter drill bit is passed. We put in a curette to protect the femoral cortex. Then under vision, we see the drill bit coming into the joint. Then we pass a suture retriever from the tibial tunnel and retrieve the suture through the tibial tunnel. Over this we pass the endobutton, here in this case a tight rope, and keep on pulling it till this tight rope endobutton reaches the far cortex, and this spot is marked with the help of marker. When it reaches the 35 mm length, it is flipped and again reconfirmed by looking inside the tunnel. That it has flipped. After this, we keep on tightening the alternate threads of the tightrope so as to bring the graft into the joint, and we have already marked this graft at 20 mm diameter with the help of vicryl, so that at least this much of graft is inside the joint. Then we fix the tibial tunnel with the help of interference screw and reconfirm our fixation with the help of a probe, which seems to be very tight and snug. Thank you.